Hi, Miss Ryan. My name is Amy. I'm the dietetic intern at this facility. Would you mind verifying your name and date of birth for me?
Vanessa Ryan, March 14th, 2001.
All right, thank you. So I'm a dietetic intern, as I said, and I'm going to be performing a nutrition assessment on you today. So what that means is I'm going to be performing a physical exam, and this includes just examining your body from head to toe and looking for signs of any changes in fat loss, muscle loss, or nutritional deficiencies. Is that okay with you?
Yes.
Okay. So I'm going to start by going over your chart and just pointing out some things that your nurse already noted. So your blood pressure is 112/62, which is within the normal range of below 120/80. Your respiratory rate is 17 beats per minute, which is between the normal range of 14 and 20 beats per minute. And your pulse rate is 50, which is right between that normal range of 40 and 60. So this means that there's no obvious signs of any heart complications, and your heart is working well. So first I'm going to start out by performing a exam on your hair. So would you mind taking off your sunglasses for me? And what I'm going to be looking for is any thinness, sparseness, or dullness, which might indicate a deficiency in protein or essential fatty acids. So it seems that your hair is looking great, it's shiny and healthy, and there's no thinness or dullness or any signs of hair loss. So that is good. So now I'm just going to assess underneath your eyes right here and on your temporal regions. And I'm just looking for any signs of fat loss or muscle wasting. And can you clench your jaw for me? Perfect. And now I'm going to have you open your mouth slightly while I feel your temporomandibular joint. Open it slightly, a little bit more. Thank you, and close. Did you feel any pain or discomfort?
No.
Perfect. So now I'm going to assess your cranial nerves. So I'm going to ask you to do a few things for me. Can you smile big? And then puff out your cheeks. And stick your tongue straight out like this. And then move it back and forth from side to side while it's out. Thank you. All right, now can you open big? And say ah for me?
Ah.
Okay, perfect. And now can you shrug your shoulders? Up, up and down. Perfect. And now can you move your head this way? And the other way? All right, thank you. So it seems like all your cranial nerves are working properly. So next, I'm just going to add a dysphagia screening on you, and this is just going to see if there's any abnormalities in your swallowing. So I'm going to put my hand on your throat, and I'm going to have you swallow for me. Okay, now was there any discomfort or pain during that? Okay, good. Now I'm going to ask you to say ah one more time.
Ah.
Keep going.
Ah.
All right, perfect. So everything sounds clear. There's no signs of gurgling or coughing. So that means that there's no obvious signs of any swallowing difficulties at this time. So next, I'm going to perform an assessment on your tongue, mouth, and teeth. So first, I'm just going to examine if you have any drying, cracking, or any obvious signs of chelosis or stomatitis, which may be signs of dehydration or any vitamin and mineral deficiencies. And everything looks good so far. Now I'm going to have you open your mouth. So I'm just going to take a look inside at your buccal mucosa. Good. It seems to be pink and smooth and no obvious signs of lesions. All right. So next I'm going to have you stick out your tongue. All right. So I'm just looking for any signs of glossiness, smoothness, or change in color, but everything looks good. It seems to be rough in texture and pink as it's supposed to be. So you can close your mouth. And would you mind if I pull down your lip for a minute? Yeah, just like that. So now I'm going to examine your labial mucosa and your gums and your teeth just to see if there's any obvious signs of inflammation, bleeding, redness. But everything looks good. Everything seems to be intact. All right. And I'm just going to check your upper lip now for the same thing. Perfect. Okay, so in your oral cavity, there seems to be no signs of nutritional deficiencies, vitamin and mineral deficiencies, or dehydration. So we are now going to move on. All right, so now I'm going to have you stand up so I can perform an examination on your upper body to assess for any signs of muscle and fat wasting. So I'm going to start with your trapezius muscles. And can you just put your arms down to the side for me? And I'm going to move towards the acromion process. And what I'm looking for is any obvious bony protrusions, any squaring of the shoulders, which may be a sign of muscle loss or malnutrition. But everything looks good. Your shoulders are nice and rounded, and there's no obvious signs of muscle loss in your trapezius or your acromion process. Good. So now I'm just going to have you sit back down. And I'm just going to assess your clavicles for the same thing, for any signs of muscle and fat loss. Now they are prominent, but this is very common in women, so it doesn't mean that it's a sign of necessarily any malnutrition. And now I'm going to move over to your arm and bicep region. So I'm just going to have you make a 90-degree angle with your arm for me. And now I'm just going to palpate underneath and examine underneath your tricep region. I'm just going to see if there's any obvious signs of fat loss. So since there's about 1 inch, that means that there's no sign of fat loss or muscle wasting in that area. Perfect. So now that I have your arm, I'm just going to assess your skin. I'm just going to assess your skin for any moistness and smoothness, which everything seems to look good. No sign of any deficiencies or dehydration in your skin. Perfect. All right. So next, I'm just going to move down to your hand, and I'm going to perform what's called a skin charger test. So this is going to test for any obvious signs of dehydration. So I'm just going to lightly pinch your skin. And since it instantly fell back, instant recall, that means that there's no signs of dehydration there. And now I'm just going to move down to assessing your muscles right here, your interosseous muscles. So I want you to put your pointer finger and your thumb finger together like you're making an OK. And I'm just going to feel for any signs of muscle loss here. But everything seems to be good. Perfect. Thank you. Now I'm just going to examine your nails, and I'm going to look for any signs of nutritional deficiencies. So first I'm just going to look, and your shape of your nails seems good. It seems to be rounded and no concaving. There's no obvious lesions or lines. Perfect. And now I'm just going to perform what's called a capillary refill test. So I'm just going to press lightly on your nail. Perfect. And it returned back to normal color right away, which is good. But that is a test for dehydration or poor blood flow. So everything seems to be functioning properly there. Now I'm going to have you shake my hand and just have a nice firm grip. Perfect. All right, so that's just a test for your functional status, which seems to be great. And now I'm going to move on to your legs. So I'm just going to have you put your leg up on this chair for me. And can you just bend it at a 90-degree angle for me? Yeah, perfect. Thank you. So first I'm just going to palpate your quadriceps. I don't notice any obvious concaving or any obvious signs of muscle wasting. There, perfect. Now I'm just going to move down to your patellar region, and I'm just going to notice if there's any bony or prominence or any signs of muscle loss around the knee, which everything looks good. And now I'm just going to do the same thing on your calf, assessing for any thinness. Nope. Very muscular calves, are in shape. All right. Now I'm just going to check for edema. So what I'm going to do is on extremities, so I'm going to palpate your ankle and below your knee. And when I press in, there's no indentation, which means there's no signs of edema. So that's good. And so now I'm going to have you sit up for me. All right. So now I'm going to assess some of your pulmonary function, which is your lungs. So I'm just going to have you take one deep breath in for me and breathe out. One more. Now I'm going to perform what's called tactile fremitus. And so I'm going to palpate you, and you're just going to repeat the phrase 99, 99, okay? Just keep repeating it. All right, go.
99, 99, 99, 99, 99.
All right, and I'm going to have you stand up, and I'm going to do it once more on your back. And nice and loud. I'm just going to be looking for the vibrations.
99,
Keep your arms
Nope.
aside.
99, 99, 99, 99, 99,
Perfect.
99.
So all of your vibrations and sounds sounded clear and symmetrical, which means that there's a normal amount of air in the lungs and there's no fluid, so your lungs seem to be pretty healthy. Next, so now I'm going to assess different areas of your chest and listen to your heart sounds so we can detect for any murmurs or abnormalities. So I'm going to start with your second right interspace. All right, and now I'm going to move over to your second left interspace. And then your second, and then your left sternal border apex. All right, so all your heart sounds sound good, no abnormalities or murmurs. Everything seems to be normal. So next I'm gonna assess your abdominal regions for any GI disturbances or abnormalities. So first I'm just gonna have you stand up quickly so I can take a look. All right, so upon initial assessment, there seems to be no distension and your abdomen seems to be relatively flat, which is good. This is indicative of a healthy adult. So now I'm actually going to have you lay down. Okay. So now I'm going to listen to your abdomen to assess your bowel motility. So your bowel sounds seem to be normal. They're gurgling, which is good. They're not dull, and they're not hyperactive, which could mean that there was a bowel obstruction, but there's no obvious signs of that. Next, I'm going to palpate your abdomen. I'm going to start with the upper left quadrant and move to the lower left quadrant. And then I'm going to do the same thing on the right side. Do you feel any pain or tenderness?
No.
Okay, good. All right, thank you. So you can sit back up. Thank you. So everything seems to be pretty healthy today. Do you have any questions?
No.
All right, thank you.